kind of the bulk of my research right now is looking at green spaces, which includes any areas with natural vegetation in our built environments, such as parks, gardens, lawns, street trees, and forest and tree canopy, and how they may be related to kind of health behaviors and exposures, and ultimately impact our brain health throughout our life course and Alzheimer's disease and dementia risk in older age. And a number of studies have been coming up in recent years, finding some evidence for a beneficial association between green space exposure and reduced risk for dementia and kind of slower cognitive decline in later life. But this study was kind of focused in on how many are really looking at racial and ethnic disparities or differences in these associations, how diverse are the populations that are in the studies to date, to see whether we need to kind of focus in more on that in future studies. Focusing on neighborhood green spaces, such as parks and greenness and tree canopy measures, looking at the published literature to date on studies looking at associations between green space and Alzheimer's and related dementia outcomes, and how much of those have included racially and ethnically diverse populations, how geographically diverse the studies have been so far, and also how many have looked at differences in associations depending on race, ethnicity, and what did they find. And so we found that 54 studies have been published to date looking at these associations. Of those, 74% have found at least one positive or beneficial association between neighborhood green space exposure and Alzheimer's and related dementia outcomes. But only 37% have included racially and ethnically diverse populations in their studies. And then only 20% of those studies have been done in non-Western world countries. So if you flip that, then 80%, where the vast majority have been conducted in the US, Canada, UK, Western Europe, Australia, and New Zealand to date. And then only 3 of the 54 studies looked at differences in associations depending on race and ethnicity of the participants. 2 of those studies found no differences in associations, and 1 found that individuals with greater access to parks in their neighborhood had a greater odds of maintaining or improving their cognition, specifically global cognition, over time. And this was only seen for the Black and African American participants and not the white participants. So overall, building evidence for beneficial associations, but limited racial and ethnic and geographic diversity in the study so far. So this is something to really target in future studies. Yeah, a lot of these published studies to date really haven't looked at longitudinal change in cognition over time. So that's very important to take a look at. If you're looking at kind of social determinants of health, things that have been long-standing throughout your life, you may just have these baseline differences in cognition or other brain health measures, and it's really important to look at longitudinal change in those measures in later life to see if there's really some kind of causal evidence for an association. And so that's kind of part of the focus of my future work, but also really focusing in, like I said, on kind of more diverse populations and trying to see which neighborhoods are the most disadvantaged and can kind of greening interventions, increases in park space or access or even quality of green spaces can help kind of improve health behaviors and exposures and ultimately brain health for those who have the greatest disparities in Alzheimer's and related dementia.